Okay, good afternoon, everyone. Thanks so much for joining. This is Robert Gabriel. I also have Michael Salib with us on the line, Kim Fergus, and Robert Dominguez. Okay, so this is just to start hearing and communicate with each other what's happening, what's not happening, and what should be the next step. So, Michael, do you want to give us an update, please?
Yes, good afternoon, everybody. So the biggest update or the main update, which I know it's a big question for everyone, is Connect Center coming back. As of right now, it's not. We don't know the timeline of when Connect Center is coming back and if it will come back. A little bit of background, Connect Center is where you would typically look at your reports, look at the journey of your claims. It is right now unknown of when it's coming back, but that should not prevent you from sending your claims. There has been a misconception or misunderstanding of if I cannot access Connect Center, I won't be able to send my claims. That is not true. As long as you're not getting an error message from an EMF perspective or any other error messages that you're not familiar with, you should be able to send your claims. You should be able to receive reports. You should be able to get your ERAs. And the only manual labor on your side would be to follow with your payers on some of the claims or any of the claims that you have not been able to get processed or get accepted. Aside from that, the talks about Connect Center is looking more like end of July if it comes back. If not, Optum, which is the company in charge now for Change Healthcare, is looking into an alternative to be able to get you to a different portal, and a completely different solution would be to migrate over to eMEDIX, which does have their own portal and serves same and more features of the Connect Center or what Connect Center used to offer. Robert
So,
Dominguez
Michael,
and Kim.
why don't you tell us the experience of what percentage moved over? What's the pros and cons?
Percentage, from our Change Healthcare perspective, like our clients, I think we moved, Kimmy might correct me if I'm wrong, I think we moved close to 60%, if I'm not mistaken, from our Change Healthcare, I would
Probably
say.
about that, yeah.
Yeah, the pros, you're safer.
Well, I don't know. I don't know about safer because, with all honesty, any company can get hacked.
That is true.
So they might not be
I-
as huge as Change Healthcare is a monopoly it's owned by a payer. It's so big. It's one of the largest, of course. So the bigger you are, probably the more loopholes can be, and that's how, and the more chance that if they get hacked, they will be paying from what I heard, they actually paid twice, not once, because the hacker got greedy and they took them to the cleaner twice.
Pros of going to eMEDIX is you have access to the portal. Pros of going to eMEDIX is it does come with eligibility, which for clients that use eligibility, but actually does have also enhanced eligibility, which is something Change Healthcare did not offer and could not offer. I'll jump into cons. Enrollment process. Enrollment process does take a while, and it's not something that unfortunately we're in control of. The process it takes from one payer to the other, and everybody was re-enrolling and everybody was trying to get to a point where claims get accepted. So it's not, this has been the biggest con of the process, but it's something that we diligently work on and we're able to eventually get enrollments going. The other actually big con is some payers had exclusive relationship with Change Healthcare. Those payers, if I'm not mistaken, are either still pending or in progress. Kim, you might weigh in on that. I know we have a few that we had an issue with, if you don't mind sharing that experience.
Yeah, absolutely. So as Michael was saying, there are some payers that do or did have specific rights for sending claims and ERAs. Even though we had clients using eMEDIX, they were going through Change Healthcare. So when the incident happened, it did sever that. So what eMEDIX was working on was rerouting all of those connections. So claim submission and ERAs, they were able to find different paths for quite a few of the carriers. There are still a handful that are outstanding that they're still researching. But in terms of coming on brand new to eMEDIX, a lot of your major carriers do have active connections now. We don't have issues with those so much anymore. There are a few outstanding. Off the top of my head, I know Clover is one of the carriers that they're still working on. But if you are interested in switching to eMEDIX, we can send you over a spreadsheet for eMEDIX to let you know which carriers are not currently online if you want that to help make your decision.
Can we actually drop this sheet in the chat so everybody has access to it, Kim, in case that would be a deciding factor of for anybody that's currently using Change
Absolutely.
Healthcare, but on the fence of going to eMEDIX or not, then that could be some sort of help. That would be great.
Of course, I'll drop it right now.
Awesome. Thank you. Yeah, aside from that, Robert Dominguez, you're pretty involved in the EDI part. Do you have anything that you would like to share with the attendees about going live with Change or eMEDIX that they should know or should be aware of?
The change to eMEDIX?
Change to eMEDIX or current status of Change Healthcare for clients that did not go to eMEDIX. If you have anything that staying on Change Healthcare that they should look out for, or going to eMEDIX, what they should be prepared for.
Sure. Thank you, Michael. So one of the things to just note that just because we don't have access to the Connect Center website, that doesn't mean that we don't have access to be able to see what's going on with your claims. These notifications should still be coming through your revenue management application and the reports part of the application. If you were a part of maybe the connection method, when you click send, it automatically sent your claims and you got your reports. You should still be seeing those same reports that indicate the status of claims. Those reports would start off with the CA or an EC, which would have claims acknowledgement or exclusion. Those reports would indicate the status of claims at the clearinghouse if they're accepted or rejected. And then if they're rejecting at the payer, you should see reports that start with an SB, SE, or SR. Those are going to be the payer acknowledgement reports. If you were using the clearinghouse Capario, which is now called Change Healthcare under Optum, those reports will be on the website, and people who were on that particular clearinghouse, I believe, now have access to be able to see those when the system came back online for you when you're able to submit claims, because you actually had to go to a website to upload the claim. So you should see or should be able to access those reports. And if you are having some questions on how to see that or how to access that, you can give us a call or shoot us an email, and I can work with you guys one-on-one to see that. But the ones who were able to submit claims automatically, you should see those reports in revenue management reports.
Awesome. Thanks, Robert. Anything in relation to eMEDIX? Any pros and cons that we missed or you think our clients should know about if they're trying to decide?
One of the good things with eMEDIX is with the reports. I think it's a lot more streamlined. So with Change Healthcare, you're getting like 10, 15 different reports. A lot of them are just duplicates of the other. They're just laid out or displayed differently. With eMEDIX, the reports for the claim statuses, they're pretty much going to come back in one report, whether it's a rejection at the clearinghouse or rejection at the payer, and it actually indicates what exactly is happening with that particular claim, and then what adjustments or that we need to make within the software to correct those rejections instead of searching through several different reports. And then obviously with eMEDIX, you also have the ability to access the claim statuses online on the website. If that's a lot easier for you to manage your claims, they have that capability, and it's available now instead of waiting for Change Healthcare's system to roll out a new portal or for them to restore their previously used portal. So I think that's one good thing to note about the eMEDIX, in addition to everything else that was mentioned.
Thanks, Robert. I guess, Robert Gabriel, do you have anything else to share before we start looking or answering the questions that came in?
No, let's open the floor for questions.
Okay.
Let's type the questions, and Kim is going to read it for us.
We have
Absolutely.
the questions typed. Go ahead.
Yep. So the first one is from Dr. Parikh. I'm still not getting some ERAs, and they told him to speak to Microwize from Change Healthcare.
So with ERAs, I guess we would need check numbers, check date, payers, and amounts. I know we have somebody on this call that has had this issue. I don't know if, not that I don't know, Change Healthcare is not very communicative in what needs to get done. So I know we still have a pending ticket for one of the clients on the call. Robert Dominguez, do you have anything to say about requesting older ERAs now that Connect Center is not up and running yet?
I haven't ran into any issues yet. But Dr. Parikh, it is correct. They're saying to contact Microwize. We should be the ones that are resolving those issues for you. So if you do find that you're missing an ERA, just like Michael said, we just need to get specific information about the check, and then we can then open up a ticket with them and have them track it down and see if they can actually restore it. If we're finding that it's just a specific payer and we're just not getting anything at all, same thing, you would just need to let us know specifics about what the payer is, and we can find out if it's just an issue with that particular payer, maybe the connections haven't been reestablished for that specific payer, or maybe there's some sort of issue that we're not yet aware of. And we would just need to let them know, let Change Healthcare know, so we can find out what's happening with it. And then they can investigate it and determine if it really is an issue or if it's just something that they can address on their end to start receiving those.
Yeah, I
I
was
did
not
place-
talking about old ERAs, which is fine, but I was talking about the new ones because somebody referred to the old ERAs, which I'm sure will probably take time. But the new ERAs, have the payer IDs changed, or are we supposed to do something at our end so that we do get the ERAs, or what is the problem?
Should be downloading anything that's ready for you in your mailbox. So whether it's old or new, I did place what information we need. So please send that to board@microwize.com. Check date, check amount, check number, payer name, payer ID is what we need. And list whatever you have, or whatever you're missing, whatever checks that went into the bank, but you did not actually get ARAs, list those, please. So we can open a ticket with Change Healthcare and then see if we can track him down and bring him to you.
Got you. And what about the refund we were supposed to get for 2 months from Microwize? I wrote an email and I haven't heard anything, but is that something that you won't bill for next 2 months, or is it you're going to send a refund? Or I think Robert was saying it would be easier not to bill for a couple of months.
Dr. Parikh?
Yes, go ahead.
Finance has taken care of that, and one of our finance specialists is actually going to reach out to you just to explain how that was taken care of. They had stopped one payment and they've credited it to a different month. So it would have been that you just were not charged.
Thank you.
You're very welcome. But they will be reaching out just to explain that further if you have any other questions, okay?
Thank you, Kimber.
You're very welcome. Thank you, doctor. Okay, the next one we have from Faten. I don't know if I pronounced that correctly. I'm so sorry. We're living with the hope that we will be able to access our claims history with Change from February until now. But if we switch to a different clearinghouse, we won't have any info for that time period, right?
Great question.
Yeah, so if you do switch clearinghouses, unfortunately, the new clearinghouse will not have your past claims history. It will only be from the claims that you were submitting from that point forward. When you switch clearinghouses, Robert Dominguez, do you have any information on what they might be able to see when it comes back online, or we don't have anything?
We don't have anything on
Yes.
Center just yet.
We don't have any information. I'm suspecting this might be partly for timely filing purposes. We can display some information from within the software that you submitted it. So we might have to handle that at case-by-case basis. If we're having an issue with a particular claim that you submitted and we're just having trouble tracking it down and whether or not it reached the payer or whatever the case is, we might have to handle that at case-by-case basis and work with the clearinghouse to get specifics if that's what we're looking to do. But yes, if we switch clearinghouses, we won't have access to that history as soon as we sever connections with our Change Healthcare. I'm hoping that when they do come back online, we would still have that history, but I wouldn't really count on it because they've been pretty clear from the beginning that when they restore services, that there's going to be some gaps in the data that's restored. So that's going to be questionable if that's going to be available.
Okay. The next we have from Teresa Williams. How can we get missing remittances and ERAs? She says that she has sent them in, but she hasn't heard anything yet.
We have, that's actually Teresa's the one that I was referring to. We do have a ticket that's open for you, Teresa. We just have not heard from Change Healthcare. I believe Ahmed was the one that opened the ticket for you, and we have not been able to get a response just yet. So allow us a couple more days. I know you've already waited, but it's just hard to find somebody at Change Healthcare that is actually able to give us some sort of information about this specific part. But we will be following up with them to see if we can get some sort of help or an answer and update you. But if you are missing any more checks, please send them in, like I mentioned earlier, so we can add them to the same ticket. So hopefully we can get everything or added for you.
The next one we have from Sandeep. I checked my remits to Optum. I submitted 6 claims on May 2nd. Just testing it out. The payer acknowledges the remittance, but it still says not paid. How long do I have to wait until the status changes to paid?
I think we're referring to the website And maybe perhaps this is a corporeal client. I'm not sure because we wouldn't be able to see this information on the Connect Center website with it not being available. Not all payers will have that status update to paid if you're looking on the website to see these statuses. Some of them I know have in the past, but it's hard to say if that communication has been fully restored where the same payers that responded saying that they paid it, it updates in the system. I think with these, maybe we just need to verify that we're actually getting paid from the payer. And it's just a question of it not showing up on the website. If it's that specific situation, then maybe we can check with the clearinghouse. If it's a situation where we're sending claims and we're not getting paid, then we need to investigate that and find out what's going on. So let us know if that's really what's happening. We're sending claims, we're not getting paid. And that's what it's indicating on the clearinghouse website. And then we can work with you on that. You just reach out to us and let us know.
Okay. Next, we have from Susan. I've not received ERAs from Cigna after cyber attack. Can you help me with this issue?
Same thing. If you have not received, I guess I'm going to cover this topic just to make sure that everybody knows it's the same answer, just so we can, I don't want to repeat the same answer. Just if you are missing any ERAs, please send an email to Microwize on the support email, which is support@microwize.com. including the check numbers, check date, check amount, payer name, and payer IDs. If you are able to gather all this information and then send it to us, we will open a ticket with Change Healthcare to see if we can get access to those ERAs and let you know the cycle of that ticket. We do not know as of right now. I believe Teresa, I think her ticket was opened earlier this week, if not slightly before then, and we have not gotten word from Change Healthcare, so we're not really sure what their timeline is, and we unfortunately have access to little to no information on that part. So as long as you're able to wait, please do that. The other option would be if you're unable to wait and you okay with an EOB, contacting the insurance. If of course you've gotten paid, you can contact the insurance and get an EOB so you know how the money has been distributed. So that's plan B if you're unable to wait, because we don't know how long we have to wait for Change Healthcare to respond.
Yep. And the last one that we have here is also regarding from CMS from John. I think that's all the ones we have right here for now.
So we did record this session. We will send it out just in case if you missed a part of it. There's nothing scheduled for future meeting because we're hitting a dead end here. It's as soon as we have news about a new portal or a new method other than switching the clearinghouse altogether, we will post something and we will host another meeting. So again, the support@microwize.com, that's where you need to send your inquiries about the ERAs. And if you want to switch, you can also send us a request and we will take that if you want to move to a different clearinghouse. I want to thank you so much for your patience. I want to thank you for your business. Thank you for your time. This is our contact information if you want to reach us personally, to me or to any one of us. Now, if you reach out to Michael or Kim or Robert Dominguez, if you leave a message, they might not be able to return a message right away. So please don't do that because sometimes they schedule from back to back and they don't have time to retrieve the message. They depend on the support queue to handle the message as they always scheduled by the project manager and they don't control their own schedule. Okay, thank you so much, everybody. Have a wonderful weekend.
Thank you, everyone.
Thank you.